Welcome to the Birth Journeys podcast. I'm your host, Kelly Hoff, BSN RN. I am a wife, a mother of two, and a nurse specializing in the care of women and newborns. In this podcast, we will share powerful journeys of birth givers with the goals of lifting the veil on the birth experience, healing through sharing, and beginning an open conversation to strengthen trust and promote transparency between birthing people and healthcare providers. This episode depicts pregnancy loss. Listeners who are sensitive to this topic may prefer to skip this episode. Hello. Today I have with me Arya Pretlow. Arya is a certified nurse midwife, an international board-certified lactation consultant, and a certified yoga therapist. On top of that, she is a mom, and she is in the process of getting her Doctor of Nursing practice. Today, she's going to talk about her birth journey, and if you want to work with Arya, you can go to apwellnessservices.com and message her, and that will also be in the show notes, so you don't have to remember that. Arya, welcome, and thank you for joining me.
Thanks, Kelly. I'm very happy to be here again.
Me too. I'm excited. I have not heard this full story, so
we never had enough time after hanging out at the nurses station to go into detail.
Yeah, after like 6 years. I've heard bits and pieces, but not the full story.
Yeah. Well, it all started.
Once upon a time, a girl and a boy.
Yeah. Exactly like that. First of all, I love being able to share this story because I think it's, in my experience as a provider, both at the bedside on labor and delivery and definitely as a nurse midwife, it has been so helpful to, have a reasonable amount of sharing personal information. Like, you never want it to become about you, but sometimes the patient very much appreciates knowing that the person caring for them has experienced something similar. And so whenever I work with people who have had like a long journey to get that sticky embryo that they can carry all the way through to birth and then have a healthy live birth after loss, that's always been really useful. So being able to relate to patients and share a little bit about my own experience so that they can feel even more understood and heard and seen in the care that I provide. That has, for better or for worse, as far as my own personal history goes, that includes difficulties conceiving. It includes early pregnancy loss. It includes not one, but two ectopic pregnancies. And then finally, an unplanned conception that resulted in a healthy all the way term, almost 42 weeks gestation, and a home birth, an on-purpose home birth, and this healthy, amazing, now 9-year-old. So thank you for asking me to come and talk about it, because it's not just a kind of a triumphant story, but also one of really, it's just humaning, right? Like, we're just going through trying to deal with each new situation we have to face, whether it was one that we on purpose chose or not. We just are always doing the best we can. So my first pregnancy, I guess we could say that I know of, because all of us technically have probably had some pregnancies that were such early losses we didn't even necessarily know it happened. But the first planned, I want to get pregnant, happened really easily for us. We had been married 5 or 6 years. We had just gotten out of the military, settled in. I really had that, like, what we think of for me, at least my grandparents' generation, of like, you get home from war and you just want like white picket fences and your 2.3 children and your cute little dog chasing the kids or whatever. I very, very much wanted that when I got home from serving overseas in the war. And we wanted to get like settled into civilian life first. And so then when we felt ready, we basically, it was like, okay, we didn't really have to like chart. I didn't even know about any of that kind of stuff. We just, had a bunch of sex and made a baby. At that time, I was late 20s, so that helped, I'm sure. And I already was very enthusiastic about living in a part of the country where I knew that home birth was a feasible, relatively common and safe option. and we were in Seattle. And so I think I was like 4 weeks and 3 days pregnant. Like I had just peed on the stick. It was like still hadn't gone out in the trash yet, probably. And I was calling midwives and being like, will you be my midwife? I am pregnant. And it turned out that even though as a midwife, a lot of people do that. Of course, you're very excited, and I totally get wanting to start care. But for most people, there's really nothing for us to do that early. There's really, except meet you, like have a meet and greet, and like we could run some labs, but there's nothing to do it really in the care until a little bit further along. So I connected with a midwife. And she was like, yeah, come on in and we can like confirm the pregnancy. We'll do the blood tests and everything. And so I went in, and those initial labs were fine. But by the time I got in to see her, I was maybe like 6 weeks or something. So the initial labs were fine. And then the next, you do the like serum quantitative to see, did your HCG go up the way it should? And how's your progesterone looking and all those things. And I got a phone call on Friday that said, this isn't looking good. And I just want to let you know, especially as we go into the weekend, that this is not a viable pregnancy and you should prepare yourself for having a loss. And I did all the things people do. I think I, took long walks and cried and yelled and bargained and started bleeding by Monday. And so I had what we all thought was just an early pregnancy loss, just a miscarriage. But about 2 weeks later, I had a horrible pain. And I had this kind of pain in my lower abdomen throughout, like since really early on. And, people were just like, it's growing pains. It's kind of doing that thing people do to try to be reassuring, but really it ends up dismissing the concern. And so it wasn't investigated. And knowing now what I know, I wish that I had an early dating ultrasound, because it would have identified that, in fact, all along I had an ectopic pregnancy and we could have treated that condition early. But instead, because that wasn't what was done then, or perhaps with the practice I chose, about 2 weeks later, I had this terrible, terrible pain, ended up the short-ish version of it in being diagnosed with an ectopic pregnancy. And the embryo, of course, had died. It can't keep growing, but the placenta is dumb. Placentas are not smart. And so it just keeps growing. And the radiologist was like, you don't have to go to the emergency department, but you absolutely have to get this treated today, which was a Friday. So, and we were just like, what does that mean? So we called the midwife, and the midwife's like, well, it's not in my scope to treat it, but I'm going to send you over to this, OB-GYN. So I go to the OB-GYN, and it's the office full of pregnant people, and, it's just all the awful things. And I was treated with something called methotrexate because I didn't want to have surgery. The interesting thing with ectopics is, while any kind of pelvic inflammatory disease or surgery in the pelvis increases your risk of having one, most people who have one have never had either of those things. So I had never had an STI. I had never had a procedure. I had no risk factors except just being a person who got pregnant. And so I was like, oh, you can't take my tube. I feel like I might need that. So I chose to get methotrexate, which is a medication some people may be familiar with because we use it to treat other conditions. But it's basically chemotherapy to kill the placenta. And if I had to go back and do it again, I would have had surgery instead, because it was like 2 months of recovery for me, because it's so slow to break down the placenta. And, the fallopian tube it has a little tiny bit of like diastasis action, like your guts do. And so the way I envision it is like chunks of placenta are, kind of deteriorating, and it still has to move through the tube. And that was, imagine kidney stones, right? I mean, it's like, it was excruciating, and it would happen randomly. So I couldn't drive, and I couldn't until all of that was done and had wrapped up. So that was my entree into pregnancy. And so, the follow-up was basically like, we're going to look at your blood and make sure, that it worked, so that you don't have to get a second treatment or possibly surgery if for some reason it wasn't responsive to this drug. And then the nurses literally said things like, oh, I just know we're going to see you in here pregnant in a few months. And I was just like, how do you know? I'd like to know how you know that. I don't know that. It didn't feel good. to be told that when you're still in the throes of like a very painful physically and otherwise loss. So that was one of those things that when I think in my practice, the things you learn not to do, it's like, don't say those things. You don't know. You don't know that. So it took us 2 more years to conceive again. Not for lack of trying. We started temping and taking charge of your fertility, old school paper style. There weren't apps and stuff for that. This was the early aughts. And so I would dutifully take my basal body temperature every morning and track all the cervical mucus and all the signs and all the things. And I clearly was ovulating. It just took us like 2 years to do it. So we finally conceived again, had a very early loss again. So this is like 2008. And I remember for that one, it was like the Friday before Memorial Day when I started bleeding. So I had a positive at-home pregnancy test, I don't know, on like Tuesday or Wednesday, and Friday started bleeding. And given that I had quote unquote miscarried with the first one before we found out it was an ectopic, I was like, oh my God, this time I'm going to die. So we went to the emergency department. I didn't have a provider or anything. So we go to the ED, and that was its own kind of wretched experience. And they determined that it was not an ectopic. And so it was like, okay, well, just go home and, you're already miscarrying. So just go home and continue with self-care. So we did that. And then it was 3 more years until I conceived again. And all along that time for me, I just never wanted to do reproductive endocrinology. Like I didn't want to go to fertility treatment. I just had, for me, this very strong feeling that either I can just do this. Like, I don't think there's something wrong with me. I think it's either timing or I don't even know what, but I don't want to go and engineer it. I didn't want to. So, and I was still in my early 30s, I was kind of like, I'm a healthy, youngish person. This should eventually work out. And so the third pregnancy was a surprise. We had been trying, we would kind of go through cycles of like doing all the tracking. And at some point you're like, oh my God, if I have to hear that fucking thermometer one more time beeping at like stupid o'clock in the morning because you got to take your temperature before you get out of bed. I was like, I'm just going to throw it out the window. Like, I'm so over it. So for our health and wellness, we would take breaks from like on purpose trying. So I think we might have even been taking a break from trying. And I had it's famous last words again, I had a period, and it was a little bit of a weird period. I can't remember specifically how, but it just was a little strange. But I remember being very relieved to have my period because we were going on a family trip to Ireland. And as a person of Irish descent, this was the first time our family was going to Ireland. And it was like a pilgrimage. We were so excited. And I was like, there will be fresh Guinness and there will be like, there are things that need to happen in Ireland. So I was like, oh, well, I got my period, okay. And so I went and had a lovely time in Ireland and came home. And I remember I was a doula at the time, and I was also enrolling in midwifery school at Bastyr University. So I was preparing to become a licensed midwife. And I went to a birth as a doula, some kind of long but lovely birth. And like the next morning, it was a Saturday, I woke up and I was like, I feel terrible. And not just like strung out from a long birth, And my husband was like making some bacon and we were going to have Saturday morning breakfast. And I was like, I think I'm just like really hungry, like that kind of weird low blood sugar, but I feel kind of nauseous. And maybe I just need to eat a little bit. And I tried to eat just a little bit of like a muffin and threw up all over the place. And I was like, that's not normal. So then I was like, I don't understand what's wrong. Then my pelvis started hurting. So this really on the same side, right side was my messed up side. So my lower right abdomen, really, really painful. And I have a history of some food intolerances that cause terrible colicky gas. I have before in college, like called the hospital and been like, I just don't know what to do. And they were like, well, we can't tell you what to do. I mean, I was in college. I didn't know. So I was like, it's just gas. And my husband was like, I don't feel like gas usually makes you throw up like this. Like, what's going on? I was like, I don't know, but I'm not going to the hospital for gas. Like, that's so embarrassing. So I was like, let's just let me take a bath. I'm just going to take a bath. Well, now like my cats have started following me around the house and staring at me in that way that animals do. And they're like, something's wrong. What's going on? And he comes up to check on me. And he's like having this conversation with me of like, I really think we should probably just go. The hospital's like a mile away. It's Saturday morning. It's not going to be that bad. It's not like the downtown hospital. So it's going to be fine. And I was like, I just don't want to go for gas. And I compromised. I was like, let's call the nurse line. It's like, we'll call the nurse line through our insurance and see what they say. And so he brings me the phone and I am in the midst of telling the nurse what I'm feeling, when my last period was. And she says, have you ever had an ectopic pregnancy? At the same time that I'm like, oh my God, what if it's another ectopic pregnancy? And she's like, yeah, I'm going to suggest that you go into the emergency department right now. I was like, oh my God, I have to go. So we managed to get me. We didn't even call 911. We just like got in the car, me with a barf bowl and my husband like gunning it, right? Like, don't do that, people. People at home. Just call. Like, I didn't know. I didn't work in healthcare at the time. If you call 911, they can prepare the hospital to receive you. And if you are in shock because you are hemorrhaging inside of your body, that's a way to help you stay alive. We didn't know that. So we just sped and broke all the laws. And we got there, got me in. Nothing gets you seen faster than, not really being able to walk and then barfing all over the waiting room. So they took me back. Of course, I was hypotensive. Everything was a mess. And they ran the pregnancy test. And I remember that was the first time I had a symptom of pregnancy. I turned my head and looked at my husband. I got that smell of like hospital gurney, like the cleaning products, right? That super person smell you get when you're pregnant. And I was like, if I'm pregnant, I am not doing methotrexate again. They are taking that goddamn tube. It's like, they can have it. All it causes me is trouble. So sure enough, ectopic pregnancy has ruptured. My tube is blasted. I am hemorrhaging inside. They have called the OB, who's like, as soon as I'm finished with the cesarean, I can come and save you. And I was like, oh my God. It was a small hospital. So they pumped me full of fluids to keep me stable and do emergency surgery. And basically, like, you sign away all the things. They're like, what we saw was like, there's a mass over your ovary. We don't even know how much of you we need to take out. It looks like it's just a hot mess in there. And we might have to take the ovary. We definitely have to take the tube. I mean, it's ruined. And we're not sure how much of your uterus we'll be able to preserve because we just can't know until we open you up. Sign here, please. I was like, okay. So it turned out that the fallopian tube was twisted, kinked, and wrapped around. It had like pulled the ovary over. So the ovary was fine and I got to keep it. And the tube was, there was no saving the tube, but so I got to keep my whole uterus. It didn't like mess up the horn where the tube comes out. But they said, the thing is we can never know if this ectopic pregnancy caused your tube to be malformed like that, or if that's a result of damage from the first ectopic pregnancy, or if you just developed that way. No idea. So good luck. See you when you're pregnant, basically. It's funny. No, it wasn't funny. But basically it was like, okay, well, we've done our work. Surgeons especially, they tend to be like, okay, well, I did great. So see you in 6 weeks to reassure all of us that I really did great. And then, do whatever. So it's like, okay. The recovery from that was laparoscopic surgery. The recovery from that was exponentially easier for me than the methotrexate. It was still awful, but it was way better than the methotrexate. So, we go through all of the mourning and the shock and trauma of waking up and going into shock. And this knowledge that your pregnancy almost killed you. That was a big one. And so we at some point are like, okay, well, look, this may or may not be a very good idea. How about if we don't on purpose try, but we're not necessarily on purpose going to try to prevent either. So I'm like 36, almost 37. And I was like, I still feel like I'm fine, but at some point I'm going to know in my bones that like, I don't want to be pregnant. Like I'm going to go do other things now. So I decided for the first time to get a hysterosalpingogram to see if my remaining tube was fine or not. Cause I was like, if maybe my tube grew that way, then what's going on with the other side? It just happens that both ectopics were in the same side. And so I got the hysterosalpingogram, which, you know, you can Google it, look it up. It's, in my experience, as awful as every story says it is. was not a delightful experience. However, it did show that my left tube was patent, was fine. It looks straight. It looks open. It should be fine, but you will always have a higher risk of ectopic pregnancy. So I was like, I mean, maybe my right tube was fine until it wasn't. Like, I'm kind of reassured, but not super reassured. So there's a part of me that was like, yeah, you could bypass all of that and just do like IVF, right? Or you could just do intrauterine. Like, there's all kinds of things you could do and just kind of bypass the whole part where the embryo has to like travel, the little blastocyst has to make its way. But I just wasn't prepared to consider all of that. So I still very much felt like either it's a thing that will somehow work out or it's not. And so at some point we were like, yeah, we're just not even trying anymore. And if we can't have kids, I guess we're going to have money and time. So what do you want to do? You're like, so I made a few changes to my education plan and was in the midst of like doing this really hardcore chemistry with lab in an 8-week summer term. Because I was going to shift and do not just midwifery, but kind of shift to like naturopathic physician. But I needed more chemistry. So in the middle of that, of like 8 hours a day of chemistry, Monday through Friday for 8 weeks, I was like, I feel really weird. And I remember calling a friend of mine who was a midwife and I was like, what if I'm pregnant? And she's like, well, you should find out if you're pregnant. And I'm like, but what if I am? She's like, well, first maybe you should find out. And I was like, but oh my God, what if I'm pregnant? And so we had a plan, which was I had maintained care with the midwife who was also a naturopathic physician. And so she was the person I saw for my PAPs and everything. So we had already agreed that if I ever conceived again, we would get the earliest possible ultrasound, like get a dating ultrasound, make sure it's in the right place, you know, do all of the labs. The labs aren't predictive of ectopic, but the labs look weird. And so you suspect an ectopic, right? So that is what happens with ectopics. You can't diagnose based on the labs, but they don't look right. So my labs looked beautiful and we're like, okay. And then the follow-up labs still looked beautiful. And we were like, that seems good. And then I didn't have any of the pain that I had had before. So they were like, well, we could do this 5-week ultrasound and just get dating and make sure it's in the right place. Or you could wait another week or so and actually see the heartbeat. And I was like, I want to see the heartbeat. If I felt bad or the labs had been weird, I wouldn't have waited. And we had a very short threshold for like, eject, go to the hospital. But I was like, let's just see how viable it is. And so we went and it was, sure enough, it was an intrauterine pregnancy. And that sonographer was probably the weirdest appointment that they had had in a while, at least, because I just kept looking at it and being like, so that's my uterus. And she was like, And I was like, and that is the embryo is in my uterus. And she's like, I was like, so it's not in my tube. She's like, nope, or anywhere else except my uterus. She's like, you're correct. I was like, and so it's going to be staying in my uterus. just like trying to process that it was like in the right place and not trying to kill me. So from that point on, once it was like, this is an intrauterine pregnancy, and once we got through the, is it sticky, is it not sticky, just knowing it wasn't in a location that would end in a loss again, the rest of the pregnancy was completely vanilla. I was 37, so whatever, some extra monitoring. I was a very healthy 37-year-old and was like, okay. But there was nothing interesting about the pregnancy at all clinically because the big part for me was like, can it make it down the superhighway of your tube to actually get to the uterus and be where it needs to be? And this one did. So then I just waited and grew. I was horribly sick for like 17 weeks. And then one day was like, oh, just the clouds parted and I was like kind of functional again. So that was good. And I had a feeling it would probably be my only pregnancy. Given what I had experienced, I was like, I don't see us having the stamina to work through all of that trauma of the early stages in particular again. So I just wanted to be pregnant and enjoy it. And so that's what I enjoy. Quote, air quotes, huge air quotes for enjoy. I am not an I love being pregnant person, but I loved being pregnant that one time because things were working. And then finally, so I hired the midwives that I had trained with as a community midwife because I knew them. I knew their risk level was similar to mine. I knew their tone of voice. I knew if she looked at me a certain way or used a certain voice, like, oh, that's it. I knew them. I trusted them. I loved them. And they were like, yes, us too. So let's do this thing. And I wanted a home birth. I had always wanted a home birth from early in my academic career. One of the first papers I wrote for a college class was The Dangers of the Medicalization of Childbirth. That was before there was internet. I had to do all my research like at the library with textbooks and everything. And I was like, for healthy low risk people, it's not an illness. I also am a survivor of sexual trauma. I was like, I am not going and being stuck in some weird ass gown in some weird ass bed with some strangers I don't know, putting their hands up inside of me without asking, I'm not about that. So hashtag not all nurses, but a lot of them. And so it's like, I'm not willing to relinquish my bodily autonomy. And I'm a perfectly capable adult who can make decisions for myself and my baby. And so I was like, this is what we're doing as long as it remains healthy and low risk. My husband was very supportive, on board, educated. I mean, as comfortable as anybody is with anybody they love having a baby. It was like, okay, as long as you feel safe and cared for. And so then my due date came. And I was totally that person who was like, oh, I'm healthy and things are good. I wouldn't be surprised if I go early. No. So 40 weeks go by. Now, we know that the average length of gestation for a first-time full-term baby is 10 days past your due date. That's if your dates are even good. If your dates are good and you have a really good idea of when you conceive. So you shouldn't really expect to go into labor before 41 weeks and a half-ish. But also at 37, moving on toward 38 at that time, I was like, I don't want to hit the mark where just because I'm old, I'm going to have to go get induced. I'm the worst person to send for an induction. Just personality wise. Finally, at like 41 weeks. So she was due on like the 5th. For the record, the child did not decide to arrive until the 18th. She was born 10 minutes before we would have been 42 weeks gestation. So like on Monday of that week, I start having prodromal labor. And so every night I would have labor, early labor, regular. It would wake me up. It was painful. I could stay in bed, but I couldn't sleep except in between. And every morning when the sun came up, it would stop. And I'd be like, are you kidding me right now? By about day 3, I was like,
Are you pregnant and planning a hospital birth? You don't need a birth plan. You need a birth vision. In my opinion, birth plans set you up for failure. Yep, I said it. Hear me out before you turn off this podcast. You may think that by downloading a generic birth plan, it means you're in control. The truth is, it's not that simple. No one can control exactly how their birth will go. There are way too many variables. What every pregnant person wants is to walk into the hospital pregnant and to walk out with a healthy newborn in their arms. The journey in between is the murky part. It's hard to know what issues might come up that need to be addressed. If you focus your energy on a birth vision rather than giving your power to a birth plan, you can empower yourself to make the best choices for you and your baby. That's why you need to get into my Empowered Hospital Birth program. As a labor nurse and mindset coach, I can help guide you through the process of maintaining the calm autonomy that will help you achieve the birth vision you desire. In my Empowered Hospital Birth program, I will help you identify the source of anxiety you have surrounding hospital birth, Fill in knowledge gaps to make sure that you are fully informed and confident. Learn key phrases so you can better communicate with your medical team. Emotionally process your fears so that they don't hold power over you. Go to kellyhoff.com/empowered to book a free 30-minute private birth vision call, where we will identify your top fears and must-haves and gain clarity on exactly how you want to feel in the birth space. That's KELLYHOF.com/empowered. I'm honored to be a part of your birth journey.
I'm never gonna have this baby. So we go for our
Can I just pause and say that's why I had an induction? Okay, carry
You're
on.
like, maybe you could have been induced.
Yeah,
So
but I didn't want to find out. So I was
Right.
like, just give me
yeah. I was like,
Right.
I still have time. And so I didn't love it, but it's not like I wasn't working at the time. So I would sleep during the day when the sun was keeping me out of labor anyway. And then every night I'd be like, maybe this is the night it'll stick. And it never did. So annoying. So then
It's really the moon. It's the phases of the moon.
it wasn't the right time. I wonder, I'll have to go back and look at the calendars and see what was the
You
moon
should,
doing?
because we all know it's the moon. It's the barometric pressure. It's all the things that the Earth and gravity are doing. It's all
working
of that.
against me.
It is.
So, when you go past, especially when you're older, but really for everyone, when you go past 40 weeks, we highly recommend, and the standard of care is increased monitoring. So you go for a non-stress test and you go for a BPP, and is your amniotic fluid still okay? And is your baby doing the things we hope to see them do? Or are they starting to slow down? So, because in that case, perhaps we should just expedite this whole situation and create an exit strategy. So I go on Thursday for my NST and BPP, and everything was great except the child would not do the full body movement. I could feel her moving inside of me. I could feel her move, but it was never when the sonographer was measuring that. And so, or it's very specific about how big the movement is and how many seconds it lasts. And it never quite met what they were looking for. And so she got a passing BPP, except that it was a 0 for full body movement. And then my midwives were like, yeah, that's weird. So we've consulted with our friend over at the hospital, who was like, yeah, that's weird. But also, she's almost 42 weeks and 38. So really, how about if she doesn't have her baby by Friday, she comes in for an induction? And I was like, yes, I hear you. I believe you. I agree with you. And that gives me 36 hours to get the show on the road. If I'm in labor before then, I'll do it. So I was like, yeah, we'll make that plan. We'll do that tomorrow. It was do another NST BPP and see how it is, and then also plan an induction. So I was like, in the meantime, I'm going to see my acupuncturist. A word about acupuncture. I do not care how it works. All I know is that I don't have to understand it with my medical background and my Western science background. As a yoga therapist and practitioner, there is a whole body of knowledge that scientific method as we know it does not seem to be able to assess. How about that?
Yeah.
And I'm not trained in the Eastern methods for that assessment. All I know is that every time I went for acupuncture, my nausea felt better. My whatever was going on was improved. And so the acupuncturist that I worked with, she was also a certified professional midwife. And so she was like, I'm done with the baby catching, but I use all that knowledge to specifically help pregnant people. And so I was like, Jasmine, I need to come in and see you. So she's like, okay, come on in. She did moxibustion, and she did all the little things. And all I know is that night when the prodromal labor started, it's kept going. I stayed in labor. She even treated my husband. He doesn't actually remember it. But yeah, she was like, how about if I do some things to help with your stress? And he was like, she did some little whatever she did. So that time I stayed laboring. And so it was hot diggity, this is awesome. So, okay, that was the big hurdle to cross. And so I had my midwife come out, after okay, the sun is up. I've stayed in labor. Send Rob back to bed to get some sleep. My mom had been visiting during this time because I had invited her to be there for the birth. And then I just kept not giving birth. And so finally she like had to go home. So she actually was like leaving and I was finally in labor. Whatever. So what are you going to do? So we had the midwives come out. So when you're doing a home birth, we didn't have to figure out like when to go to the birth center, right? The whole plan was like, I am not leaving here in labor. You're not getting me in a car unless something is wrong and I have requested a change of scene and society. Otherwise, no, it is so uncomfortable. So I was still certainly in early labor. They came out, assessed. I will never forget. I was totally like, had the lights dim and like all the nice, like super labory vibe. And she was like, this is lovely. And also too early for all this labory stuff. I love them so much. It was like, just, it's very early yet. Just go do something else. Go distract yourself. Go take walks. It's daytime. You don't need to be in here like huffing and puffing like you're in full blown labor when it's still very early. And I was like, oh, right. Yeah. Okay. It's like I had forgotten all the things and I was trying very hard not to midwife myself. And so I was just like, yes. Okay, cool. So I called my doula, who was one of my classmates and a very dear friend. And we figure out when she's going to come. And Rob makes a quick trip to the store because I was like, all I want is pudding. And then we figure out a time like, when is the midwife going to come back just to do a check? They don't need to sit there and watch you be in early labor. It's very unusual for someone to pre-sip and be like, wow, my first baby came in 3 hours, But it happens. But I'd already been in labor for more than 3 hours. So it clearly wasn't happening. So at some point, they came back to administer. I was GBS positive, and so they came back to administer my antibiotics. And we're kind of like, okay, well, we're going to go do a couple home visits, see a couple more people, and then we'll plan on coming back. And we're probably just going to hang out here all evening until this baby comes. And I was like, yeah, okay. And so I remember going for a walk with Alyssa, was my friend and doula, going for a walk up and down the street and hanging out and just passing the time. Having to do those annoying things like go up and down the stairs sideways to help the baby move, which is all great and it works. But wow, now I totally get why everybody moans and groans when the doula suggests it, because it's like, I don't wanna. I just want to stand here and like sway my hips. My husband was an A+ hip squeezer. Oh man, it was excellent. And I remember just I had a really like stupid labor pattern. If I had been in the hospital, someone would have pretty quickly put me on PIT to manage and regulate it. Not that would have changed. It would have just regulated it, but because it was an effective labor pattern, it just isn't textbook.
It would have made the providers feel better.
It would have made the providers feel better. Like you're not just hogging a bed, right? Like, okay, we're doing something and this baby will eventually come out as if it wouldn't on its own.
Yes.
So that was another reason why I was like, I do trust my body in the process. And I have a high degree of proprioception. And so I was like, between me and the midwife, I feel confident if something is going sideways, we're going to make the transfer. Like I'm not the person who's going to argue that transfer. I don't want to be an emergency transfer. Anything weird, let's get out of here and be in a place that's more appropriate for the change in my status. But until that time comes, or unless, I ain't leaving. So in and out from the backyard, we have some awesome pictures of me like eating popsicles, standing in the backyard, swaying, like just trying to pass the time. Because it is ultimately, if we average, again, when it's not an induction, an average 24-ish hours, it's a day of hard work. I don't want to poo-poo anybody's experience of it being like way worse than that by any means. For me, I was not scared of the pain and I had excellent coping tools that were already proven because of the things I had experienced previously. So I was like, I know how to help my mind deal with the biggest issue, which is like how much longer and how much more can I handle? I just don't go down that path. I was like, it's one at a time. And all I did was accepted that it was coming and there was nothing I could do about it. And I would count up to 10 and then back down to 0. And by the time I was done, so was the contraction. I just lengthened it as the contractions got longer. But that way it was like, okay, that one's done. That was my primary coping tool, was just like, oh, okay, here it comes. And then I would count. and get pissed at people if they try to count with me. I was like, I do know how to count. I would get so mad. Like, you're messing up my flow. Shut it.
Shut up, shut up, shut up, shut up, shut up.
So at some point I was like, I have been awake for a very long time. It was probably like 2 p.m. or something. I was like, I'm going to go lie down. And so everyone did the appropriate thing, which was have the conversation with me about how if I lie down now, things might slow down. And I was like, I don't give a fuck. I am tired. I'm talking about like a 20-minute cat nap. It's not like I'm going to go and like sleep for 4 hours, right? Like I wasn't that kind of tired. I just needed a little downtime. So I remember I went and laid down we had a futon like in a sunny office room, and I laid down on the futon just to like rest. And then Rob came in and he spooned up behind me and like gave me a snuggle. And I had this surge of oxytocin. I felt the huge contraction. I heard a pop and was like, my water broke. And I love that story, spooning, snuggle with your, sweet, supportive person. It was like so amazing to actually experience that process. It was like feeling loved, held safe, bonded, and then bam, water broke.
Yeah.
Like, okay.
Yeah.
And it wasn't very much water. Like she just went bloop and plugged it. But it was clear.
You were 42 weeks.
Exactly. There wasn't a whole lot left. But my BPP,
Where was it
my FI was fine.
Okay.
Just to be clear. And she wasn't a big baby. So she just kind of went bloop.
Okay, that's
and
fair.
settled down in there. She just plugged it, I guess. Thankfully, there was no mech, it was like, okay, well, we're just going to keep doing this. But then, of course, as you would expect, things picked up. And so now it's like a better labor pattern, more effective. I have not had a cervical check since earlier because it doesn't do anything. And I was like, A, I don't want your hands up inside of me. I love you. And I do not give you permission. B, I am a trained midwife. I already know that it's not necessary and it's not going to change the plan. And you can tell that things like there is a labor pattern. It is shifting. I said, as they offered to check me at some point. I think at this point I was like laboring in the tub. I did not want to have a water birth. I had a wonderful like soaking tub, but the edge of the tub was like an inch. And having attended many water births, I was just picturing my poor midwife trying to hang over that tub. And I was like, no. And it's so hard. Nobody wants to get out of the tub. I was like, it must feel so nice to stay in that tub. And then it's just full of blood. Like, ew, I didn't want to. And so I was like, I will labor in the tub. And then I know where I want to have my baby. And we're going to go over in this room that I have created, the birthing den in the guest bedroom. It was like, that was the room. So that way we could train.
But you're also GBS positive.
Yeah.
So,
I mean,
keep your fingers out.
Well, that too. Yeah. It was like, and I wasn't ruptured yet, but when they initially were like, do you want to be checked? And I was like, no. But then, yeah. So it was like, at some point they're coming like regularly. Things are good. It's been, I don't know, because I wasn't paying attention because I was trying not to midwife myself, however many hours. And they're like, do you want us to check you? And I looked at her and I said, the funniest part of this story is that I thought I only imagined saying all of these words, but I actually came out of my like, between contractions kind of stage. And I looked at her and I said very coherently, no, I do not want you to check me. If you check me right now and I'm only 4, I will die right now. I do not want to hear that. I would rather not know and just keep doing things. When I have a spontaneous urge to push, then we can check and make sure, and then we'll proceed. But no, I don't want to know. I don't want to know what my cervix is doing right now. And they were like, okay, because nothing was wrong. There wasn't anything that was like, but so the takeaway from that, clinically speaking, is also I had seen so many people lose their hope when they're on hour 20, and they get checked and they're like, maybe I'm 9, especially people who haven't done it before or been to any births. Like they don't know about transition, right? So they're like, maybe I'm at least a 7, I'm 8, I've got to be close. And if they have in their mind, like this many hours should have resulted in this many centimeters. And your body doesn't have an algorithm like that. It doesn't. And so even if we as clinicians have a concept of an algorithm, we would like to see so many centimeters of change over so many hours of labor, depending on if you've done this before or not. Your body didn't get the manual. And so I've seen people who are having a perfectly normal course of labor and everyone is well and fine, just lose all hope and change their plans because they lost hope. And then it could be that you're 7 and within an hour have pushed a baby out. We also can't, it doesn't mean it will take 10 more hours to go. It could go so fast. So I was like, no, because I'm doing well and I'm coping well. And that's a thing I don't want that. That is not information I require. And so they were like, yeah, okay. At some point, it must have gotten to be like maybe around 10:30 or something. So now it's nighttime. My husband has made coffee for everybody. I love coffee. And also I was in labor. And so 2 or 3 people came upstairs with coffee mugs, steaming coffee, the smell of coffee. And I did that thing where I was like falling asleep between contractions. I smelled the coffee and it smells like fucking coffee. It's so bad. And whoever had like walked into the bathroom, like crept backwards back out of the bathroom with their coffee. I was so mad because it smelled so bad to me.
I hated that smell when I was pregnant.
It's just gross. Yeah. They were just like, oh, yep, she's probably transitioning now because she's mad. And then at some point, I totally did the thing where you're like in between contractions. I love the endorphin rush in between contractions. I love that, like, it's a lot of hard work. And you're like, wow, I really would love to be done. And also, clearly, I'm not done yet. So let me suck it up for another contraction, just one at a time. But then the after is like, oh, here, let me give you a little something to help you deal until the next one, right? Your body is just like, I got this. When it's a functional labor pattern. So again, I want to acknowledge that not everybody experiences
when you're
that.
laboring in a functional place.
Yes, when you're safe, feeling home and loved and things are, So I'm in my tub with my peeps, not in the tub with me, but like around me, not drinking coffee near me anymore. And I go, and I was like, ooh. Everybody, they did that. They totally froze. And I'm like listening and looking at me. And then I'm like, it's time to get out of the tub. So over the course of a couple of contractions, we get my very pregnant self out of the tub. And I'm like, okay, you can check me. So that was the only time I laid on my back the whole labor. So now it's probably like, it must have been around 11:20 or so because I only pushed for 20 minutes. So we probably around maybe 11, spontaneous urge to push. We start getting me out of the tub onto the guest bed because I wanted to keep our bedroom all nice and clean because that's where we quote unquote transferred to after. It's like, there's my clean bedroom. So
your postpartum
my
room.
Postpartum room was my own bedroom.
So, did you wait 2 hours and then get transferred?
Right.
Did they take you in a wheelchair?
Yeah, across the hall.
Yeah.
So they checked me and I was like, oh my God, this is the worst position. This is horrible. How, just get what you need and get out because I cannot stand being in this position. And they did, and everything was great. No anterior lip, no shenanigans. It was like, okay, great. So I pushed on hands and knees. That was just how I ended up and what felt really good. And I pushed, dear listeners, I love you all. And it's not a competition. What I'm about to say, you can't set a goal like this because it's not in your power. I pushed 3 times over approximately 18 to 20 minutes. That's just how it was for me. So it helps that I got these good birthing hips, apparently. It helps that even though my baby was an old baby, like I totally had an old lady baby with long ass fingernails. Like she was all like wrinkled and peeling and like old baby. She was small. She was like 6 pounds, 6.5 ounces. And for the record, my husband is like 5'8" and I am 5'2.5". We did not expect to have a ginormous baby. But at her gestational age, she almost was small enough that we would have had to actually go to the hospital after she was born for gestational age size. It was like half an ounce or something, and we would have been screwed. So wow. She was not a chunky monkey. She was not a big kid. I pushed real hard in a position that worked really well for me. And I had like 0 inhibitions about who was looking. No one was going to come walking in the room, what noise I was making,
what was coming
out, right? Like I just didn't care. I'd already been at so many births. And so I wasn't afraid, And I had seen many times in the out of hospital setting, it's not the norm to require a repair. It happens, but most of the time we don't need it. And so I just wasn't worried about if I tear, they'll fix it. And also those weren't the things I was worried about. So, well, I guess after maybe the third push, so maybe it was a total of 4. And my husband, God bless him, he's just like, standing back there like for 20 minutes being like, I'm ready. Because he was going to be the initial hands on her. And at some point, my midwife goes, let's just go ahead and push your baby out. And I was like, oh, fuck. I don't know what she saw. I do now. But at the time, I was like, oh, that was the change of voice. And so I was like, okay. And so I did.
Beast mode.
I was like, I don't know what's going on, but if she needs out, she's getting out. And again, it worked out that was something I was able to do. I remember the sound that came out of me thinking that I sounded like a train. And it was, again, almost midnight. And I was like, I wonder if the neighbor heard that. We live in a city, it's like, it was like, like just like so loud, like a train. And I remember the feeling of the head, the ring of fire, the head. Oh my God, the head, right? And the head's out. And you're like, okay, well, then what we do out of the hospital, but also as a CNM, I wait for it's this novel concept that the next contraction will birth the body. I don't have to pull the baby out.
You don't have to tug the baby out, yank its head.
It's still fine. It's attached to the placenta. As long as the placenta is still attached, we're good. So, so of course we're watching. It's not like you just say, oh, whenever it's going to happen. But I remember it being like, it didn't take long for the rest of her to come out. And it felt, the way I describe it, is like a bowl of spaghetti somehow, but like with the biggest noodles in the world. But it was like after the head, it was just like, like everything else just out. It was such a weird feeling. And so she had a really short cord. So here's all these things that can happen in retrospect. She had a very short cord. Was that perhaps why we needed days and days of prodromal labor just to like help somehow shift her down a little bit more? It was like she couldn't quite cause the effacement. It just took a really long time for her to apply to the cervix and start getting things going. And I wonder, my placenta was fundal, so maybe she just didn't really have the length that would have made it easier for her to do that quickly. And so it was like a little bit over. Honestly, that part I don't know, but she had a short cord and the placenta kind of practically just fell out after her. And so what the midwife told me after the fact is, in her many, many years of practice, it was the bloodiest birth that she had seen. And this is where, like, my husband standing back there, he's like, I just thought birth was bloody. When you look at pictures of me holding her, I'm like, no, it's never that. It's not, no, that was, no. I think
you start seeing that placenta blood.
Yes.
That looks different from regular blood.
Yep. I think that what happened was there was a gush of separation. And that's when she was like, you need to push the baby out, right? Like, not that I wasn't, but it was like, yeah, go ahead and get your baby out, was how she put it. Go ahead and get your baby out. Like, now.
Make this happen now.
And thankfully I was able to, because retrospectively, probably I had a partial abruption, because again, there was no like, let's wait around for the placenta to come. It was sort of just like plop. If she was out, it needed to come pretty soon. It was short enough that when I knelt back up, I was on hands and knees. And when I knelt back up, I could only lift her to my belly button. And again, she wasn't a long baby, right? So they were like, cord. I was like, okay. So we managed, my doula thankfully took a little bit of a video. I hadn't arranged for like pictures and videos and stuff like that. Cause again, I was like, I don't need no strangers up in here messing with my vibe. So my doula and friend, Alyssa, she took like this beautiful little video of both of us crying, right? And we didn't know if it was a boy or a girl. And so Rob laughing and looking around, crying, laughing. And he's like, is it a boy or a girl? And they were like, we don't know. You have to check. And I lift her away as little bit as I could to look. And I was like, it's a girl. And we both are like, burst in wholehearted sobs of relief that it was done, that everyone was safe, and that also, I think secretly we hoped for a girl, but honestly, after everything we'd been through, we didn't want to know the sex because we didn't care. I was like, it's a baby. It just needs onesies. I don't care about the clothes or anything that people care about. I just want the baby to come out eventually. And then it was just all the gentle things of like cut the cord and help her with her first latch. And, in a home birth, they've got like these sweet little, we use a fish scale. So you hold the fish scale up and you put the baby in. So you've got all the little pictures of like her little foot sticking out of the fish scale and the dog like sniffing it. And she's just like at the foot of the bed. And I like getting ready to get her little newborn exam. And I'm like rubbing her head with my foot because we're just in our bed. I remember one of the first things once that initial haze passes and you get that elation, right? And they're like, whoa. And I was looking around, I was like, can I have a sandwich? Like, I'm hungry. Can I have a sandwich? Someone brought me the most amazing sandwich I've ever had. I don't even remember what it was. It came from my own refrigerator.
It's probably nothing. It was probably like butter and bread.
Totally. I was like, and then it was like, okay, usually assuming everyone is stable, which again, the expertise of the community midwife in particular, but I would say midwives in general, but especially those whose scope is really just healthy, low risk birth, is constantly assessing to rule out anything that's not low risk or healthy so that you can make a transfer before it's an emergency, right? Like that's the point as far as I'm concerned. There are people who specialize in not healthy and not low risk. The difference is medicine says you can only determine that it was a healthy, low risk pregnancy retrospectively. And midwives say, really? I think that you can actually look at this situation right this minute. You can't say it will continue to be healthy and low risk, but you can assess them right now. All the factors that we are able to reasonably assess. And you can say, at this moment, they are still appropriate for my care. It is a healthy, low risk pregnancy and still considered appropriate for out of hospital birth. There's nothing pathological happening here. And so that difference in worldview is what makes all the difference in then the experience for the birthing person, but also everyone who's attending them. So, I mean, then it was just like she latched, we snuggled up in our bed, all three of us.
Oh my gosh.
I know. But they showed us. It was like all the things to have like a safe landing pad. We already had the mattresses on the floor. It was like, you just put her here, no pillow. Don't let the blankets go up around her face. She's right here. I'm not compromised. So it was the best sleep of our lives and the last good sleep in the last 9 years. Not really. It's gotten better in the last couple of years, but she's not a really great sleeper for a long time.
Because I'm not there yet.
No, it wasn't until she was like 6 or 7 that she pretty consistently slept well.
That's been our situation. And I have a 4-year-old, so we've got a ways to go.
It's a long time.
It is.
But it just is that thing. I remember working in the hospital and being like, they can't get that period of rest because we move them at 2 hours. And then the postpartum unit, they're just like checking and that is what they have to do. Like that is the compromise you make when you go to the hospital. You do not rest in the hospital. I don't know why anybody ever suggested hospitals were places for rest because they aren't. And most of the time postpartum, that's the number one thing you need is rest and privacy and safety. And you get safety in a variety of ways, but you don't get privacy and you don't get rest because they have to check you and your baby according to hospital protocol. And so you don't get that chunk, that last final chunk of like everyone goes to sleep for 5-ish hours and then you wake up and the rest of your parenting life begins.
Everything's changed.
Yeah. It's just like now it's all you. You get a few hours here, relatively speaking, and then it's just all you. I think with an out of hospital birth, you already have the sense that it's all you because the whole premise of the care is that it's always client-centered from the very beginning and informed decision-making and shared decision-making and like helping people figure out what they want, what their goals are, what they need. And so you, throughout the course of your care, have this sense of I'm in charge of this. And at no time there certainly are clients who are like, just tell me what to do. You're kind of like, well,
but you don't have to go to another room with another patient.
Yeah.
And,
Yeah. There's no like, I'm going to do this now and I'm going to, or we're going to, it's like, do you want, do you need, it's a question instead of a like sharing information about what's next.
Okay. I know I have some follow-up questions for you.
Okay. I'm ready.
So this may not be relevant because your baby probably just kind of made her way into the world with, like you said, about 20 minutes, not a whole lot of pushing. But what was it that clicked you into being able to push? Was it your years of experience in helping moms figure it out? Was it the feeling that you
like the how to push? Yeah.
Yes. Like where did you get those muscles? How did you coordinate all that?
This is an interesting question. I know in the hospital, we often are like, and actually this happens a lot of times out of hospital where you're like the first little while, it's not that it doesn't count, but the pushing is often so ineffective until somehow they get the hang of it, whether through some verbal coaching or maybe some careful placement of fingers in the vagina to press on that spot in the posterior wall to be like, do you feel this pressure? Aim toward that. I think because I had already spent so much time at births with people helping them visualize the curve of Caris and being like, okay, so you push into this point, sort of ish. I mean, it's like, how do you do that? It's like saying, breathe into your belly. Please don't. That's not a thing. But like your belly rises, right? So push into that because that's what helps them get under the pubis, right? So I think the combination of I knew the anatomy and physiology as a clinician. I also had already 20 years of yoga practice under my belt. So I had a really good sense of like, lift only your pinky toe, like that degree of controlling my body and being able to feel and fiddle with things, and probably some amount of luck. I don't like the instruction to push like it's a poop. I've read quite a bit about how that can injure your pelvic floor. And so I had already been for many years giving a pelvic floor, before there was so much interest in pelvic floor PT, it was sort of left to like yoga teachers, like postpartum yoga teachers, to be like, let's relearn pelvic floor stuff, right? And help people in their postpartum, like mommy and me yoga classes. So I also had that sense of what can happen if you push in that kind of way, and had read quite a bit in order to be a better provider about how to like teach people to push effectively. So I think in the moment, I wasn't processing any of that. I just pushed the way I had learned to teach people to push.
So can you share what that is? Because I mean, because here's the thing, like I had an epidural with both. I don't think that I pushed like I was pooping, but then I was told I was pooping. And so therefore I was pushing effectively just based on the anatomy of how your baby goes. You may not be pushing like you have to poop, but you push out the poop.
Yeah.
Because that's where the poop is.
Yeah.
So, but
it's in the neighboring tube. Yeah.
Exactly. It's like squeezing toothpaste out of it. Like if you start here and you squeeze it down, it will come out. Unless you cap it.
Yeah, don't cap it because then your baby won't come out.
A different direction.
It won't come out one way or the other.
Also it'll come out somewhere else, so you don't want it to come out. Yeah. So I feel like when I was epiduralized with both, but I could feel kind of a little bit with the first. Yeah. I felt like I was shortening that area, and maybe it was because I had a Pilates teacher. I was shortening the area between my pubic bone and my belly button.
Okay, yeah.
And I don't really think I poop like that.
Yeah.
I don't know.
I mean, ideally you don't have to push to poop anyway, right? Like
that is not the life I live.
That's a whole other conversation, perhaps. The joy of the squatty potty.
We might need to talk about supplements if that.
Let's talk about
fiber.
You've got
some ideas on how we can. Yeah.
Yeah. Ideally, you don't push to poop. So, I mean, there's the argument that you shouldn't.
Like my kids were malpositioned, so also like I probably have some like nerve damage there. So
yes, yeah.
Anyway,
which also makes pushing harder.
It sure does. Yeah. But if someone's pushing fine and pushing like they want to poop is the way that it's going and whatever, I'm not going to mess with that. But what I do tend to say is pretend you have a spring between your belly button and your pubic bone and shorten that spring. And that's where your push is, because you're not pushing from up here.
Right.
You're curling around your baby and trying to eject. It's like an ejection seat. You're ejecting that thing from your body.
You are.
But if you have a different.
Well, I would say one thing is like, yes, if you're in a supine position, that makes a lot of sense, right? Like, how are you going to get someone who's laying on their back?
That's where I was both times.
Yeah. So when you're up, because I've caught babies from people standing up, right? Like,
oh yeah, me too. I have no idea how that worked, but I mean, I do. It seemed to work out a lot better.
Yes.
But
so I think there's one thing I would say is that when people don't have an epidural, because you have so much feedback, not just pressure, but like there is so much information that your body is giving you. There's not a ton of instruction that usually needs to happen. unless during an assessment we're like, we can tell this baby's in, like catawampus. So we can tell they're in malposition and we ought to do something a little different. And then it's mainly just like not push differently, but be in a different position to facilitate that movement in the pelvis.
Right.
So when you're upright, like same thing if someone is kind of in the throne position, right? Like if they stay kind of squatting, you don't necessarily have to curl.
Right.
It's
more just adjusting the pelvis. It
is
like,
a lot.
You're feeling the baby. And that's usually what I try to do with people anyway. Because it's like your baby is going to come through somehow, but you got to kind of like just move it around until that head is just like down enough that it's just going to come out.
Yeah. And then it's a matter of like,
you got to be able to curve and do the things.
Because you also need, we also have to put a fair amount of responsibility on the fetus. The fetus also has work to do, right? They have to tuck their chin. Well, assuming they're positioned properly, they need to tuck their chin. And that can take them a little while. That doesn't necessarily have to do with the pushing. Because I think the other thing is, I'm not an advocate for like never push by any means, because there's a spontaneous urge to push for reasons, right?
Right.
But also it doesn't have to be like for a certain like
you're complete, let's push.
Yeah. And it definitely shouldn't be purple pushing. And you don't, know, like the things that we as a society learned needed to be done when people were like being given whatever, like I was going to say ether, but not that, because then they weren't following any instructions.
Whatever they gave,
they were just knocked out,
like come out.
Right. But like, think about that. So back then they were doing forceps and all kinds of awfulness, like on the regular, not for just cause, but nobody was pushing. They weren't adding that force. Their body was just doing it. So,
and babies are delivered to people that are unconscious.
Yes,
like
exactly.
It can happen.
Yeah. Or like paralyzed, right? Like they can also have a baby. They're not adding force. So adding force can make it more efficient, we could say, but it's not really required. But like, because they don't have, and they have no spontaneous urge to push. And if they feel some pressure, they still need you to help guide them.
That,
right?
Yeah. Right.
So in the out of hospital setting without the epidural, there's just the pushing just tends to be more effective anyway, because people are like, probably also in the hospital if people don't have an epidural, except even then, oftentimes they still are on their back. And that very position prevents the pelvis from opening and moving in the way that it should, because you've locked the sacrum.
Not my patients.
Right?
But...
Thank you. Thank you. Right. So of course they need more help. But if like on hands and knees, I was definitely not curling around at all. I think when people are supine, that makes sense. I can feel what you're talking about. And I remember being like curl and like pull.
Yeah.
And
the epiduralized ones, like I'll put their leg in the stirrup and turn them.
Yeah.
And I still kind of curl because I'll be like, grab onto the handlebar and like focus on that area.
Yeah. Like I love the squat bar thing.
The squat bar. Yeah.
Yeah. But I think, so I used kind of similar stuff. I usually tried to help people, probably because it's always so interesting. It's like how different people will do the same math problem. I often would get more into like, okay, so here's what's happening inside your body. I want you to imagine your pubic bone and imagine it's like a slinky, your vagina, right? And so your baby needs to get through that last part. And so if you kind of help aim somehow toward your rectum, it can help the baby make that curve. And then all it has to do is just come out. And somehow people who are willing to go with me are like, whoa, that totally works. And I'm like, shoot.
Yeah.
And a lot of times I'll be like, the reason it feels like you have to poop is because your baby's head is pressing on the rectum and your rectum isn't smart. And so it's just like pressure must be full of poop. And so, right, it's if either you don't actually have any poop in there, it's just baby head squashing your rectum, but go with it. And if poop comes up, I don't care. We're going to clean it up. It's not a big deal. I mean, poop's not my favorite thing in the world, obviously. And also it's part of labor. I have no
feelings about poop anymore.
Just whatever. Right. Like, don't care.
Poop just is. Poop just happens.
I love it when it's not diarrhea. How about that? Like, as long
yes. If we're, that's a whole different topic. If you could go back and talk to yourself at the beginning of this whole birth journey, when you decided to embark on this process, what would you want to tell yourself?
Well, if the technology and education I have now had been available then, I would have wanted an early dating ultrasound in my first pregnancy. That would have identified right away that I had an ectopic pregnancy. In my practice, if I were still doing prenatal and intrapartum care, if I were still doing the baby stuff, I would recommend that. And honestly, it's pretty much standard because even though it's a relatively small risk to have an ectopic, the outcomes, no one wins. And so the sooner you identify it, the better. And so much good information to get from now we know the dates. The earlier your ultrasound, the better the dates. So especially if you're like, I don't really know when I got pregnant. Fabulous. We can just identify if this is actually something that could harm you. Or if it's okay, things look good. Now we just have to wait and see if it stays, because we can't predict that it will end up a viable pregnancy, but we can at least say right this minute, it is viable. I would have done that. And then we would have known when I started bleeding that it wasn't just a miscarriage. Yeah.
I know you've done an enormous amount of emotional work in your life. I don't know where you were in your emotional health journey at that point. Do you think that there's any information you could provide yourself with that would help you get through that process emotionally?
I remember how much pain I had related to this feeling of how broken my body felt. And I would encourage my previous self to relinquish that sense of responsibility for every outcome. Most people have at least one, oftentimes more than one, early pregnancy loss. It is hardly ever because of anything anyone did. It is almost always because of a chromosomal blip. Something was not compatible with life, and so it stopped growing. The embryo dies, and your body is smart, and it flushes so you can try again. Your body, we're just mammals. We just want to make babies, our bodies at least. But because of our wonderful neocortex, we love to try and problem solve and what could I have done differently? And what can I do differently going forward? And how can I make this not happen again? And how can I safeguard? And how can I protect? And and you can't. I wasn't doing anything wrong, but it feels like it when you're in the middle of it. And I don't know that my now me advice would have even been well received by my then me, because it probably would have felt like more bullshit people say to help themselves feel better when you're suffering. But that's what I wish I could have done. It's a horrible thing to experience. And also it's not because I'm doing anything wrong.
And then you were talking about the unhelpful things that people had said to you. And I'm really trying to become well-versed in trauma-informed care.
Yeah.
Because I think I've probably been that person that said the wrong thing. Because what can you say? You can't fix it.
Correct.
And so you're desperately wanting to fix it. And so then you say things that make you feel like you're fixing something. Yep. But really not.
Correct.
And you're just making yourself feel better. So what kinds of things should we be saying to people when they're in situations where they just feel hopeless?
The only thing that helps potentially is to remain humble and kind of want to say fact-based. You can say, I'm so sorry this is happening. That's different from, I'm sorry you're having to go through this. That almost sounds but like I was assigned it, like some kind of rewards-based program that I just got the shitty end of the stick. What do you mean? I'm sorry you're having to, just say, I'm sorry this is happening. Say, you can say, I don't know what to say. Well, this looks very painful. That's a fact. It looks like you're in pain. And I just want you to know that I'm here. I'm just going to sit here quietly so you don't have to be alone, because all the words are just filling the space to make the speaker more comfortable. And each of the words is hurting the receiver who's already in pain.
I tend to be silent.
That's so much better.
It might be awkward.
I would rather.
But I don't have anything.
There's nothing. No.
Right.
Because it always just reeks of, it's
so fake.
It's so pie in the sky. Oh, it's going to be fine.
Right.
At least I had someone tell me, at least you can get pregnant. That was after my.
If you had to say at least.
At least. There's never an at least.
You just shut up.
And just shut up. Right. And it was because they were suffering with not being able to conceive. So to them, it was at least, and I was yeah, but my body killed my baby. I mean.
Right. And tried to kill me while
I was just are you kidding me right now? I also am a proponent of minding your own damn business. about whether people have kids. What difference does it make? I think it's a way that people try to connect, right? But if someone, given how widespread fertility problems are, do you want me to answer truthfully? Because there was a period where I would look at people and say, all my babies died. Because I was so done with people asking me that shit. I just was like, what do you want me to tell you? I'm a mother of 3 dead babies. Like, I didn't even know what to say anymore, except that I felt all the responsibility that comes with knowing you have created life, and also for reason then that you weren't able to protect it.
Yeah.
So that was like during my angry phase, which was a few years long.
Which is a part of the grieving process.
Yes. And when your grieving is ongoing for almost 10 years, that's a long time. So I think a lot of it is like, don't act like you can see the future. There was one person who said something that was hopeful that I didn't feel like slapping them. And it was super simple. It was, for what it's worth, my sister's first pregnancy was ectopic, and she was able to have 2 healthy babies. And it was just like, oh, there are people who survive this and go on to have viable pregnancies. Okay. That was like, it wasn't like, and I know you will too, because that was where it always got me. I was like, how do you know? How do you know that?
You don't.
You don't. And you can say things like, I know you're strong and this is painful. I trust you. You will somehow find your way through it. If I can help with that, please, I'm here. Right? Which is also different from like, oh, this will pass and you'll be fine. Which is like, this is going to be really hard, but you've managed through hard things before.
You will be forever changed.
Yes. Yep.
There's a couple things that I've kind of, one thing that I thought, because the family one, I just didn't ask for a long time. But I learned one thing to say is, tell me about your family.
Oh yeah. Which could be anybody.
Much more benign.
Yes.
Yes. Because you don't know if they have a partner. You don't know if their family is still alive.
Right.
You don't know but people have someone that they can talk about.
Tell me about your support system. Who's going to be here with you? Who's waiting for you? Is there any? It could be your dog. Like, I don't know.
Yeah. The other thing we had during COVID, so many losses, and now we're learning why now. The thing that I would say is, I'm sorry we had to meet like this. If it was somebody that I am like walking into their room for the first time, I wish this could be different for you. Yeah. And then when they left, I'd say, if I see you again, I really want this to be under happier circumstances.
Yeah. Yeah.
And that's about all I've ever felt like I could safely say.
Yeah.
You know?
Yeah.
And I haven't really gotten any pushback from those things. Those are, people, you can tell when somebody's like,
yeah. Yeah.
You know,
they're just waiting for you to stop talking.
They're bristling. Yes, exactly. They're trying not to punch you. You can see that.
Yeah.
You can see that tension.
Yeah.
And so I see usually relief when I say something like that. And so I feel like that kind of means it probably is better than other things.
I think one thing I've said to people as someone who's experienced these things as well is, but also I think anyone just working in the field we work in could say this, is I remember one specifically because I saw her twice. So the first time was supporting her through a loss. And the second time was like a year and a half or 2 years later with a full term healthy delivery. And so, and I got to help her with that. And so we were like, we were meeting again under different circumstances. But I remember, she commented on remembering what I had told her when I wheeled her out after the loss. And I was like, we had spent a few days together. So she knew a little bit of that, at least that I had experienced loss as well. And I was like, I'm really sorry that now you share this experience. It's very lonely, but you are not alone. And there's support from other people who've been through it. There's support for your partner because he also has to process his experience. But that you can feel so lonely in your grief that you lose sight of the fact that you're not the only one it happened to. This isn't what I tell people. I'm telling you, right? And the listeners. But like, it happened to the whole family. It didn't just happen to you. And also that it's happening to hundreds, thousands, I don't know, hundreds of thousands of people today, right now, around the world. And so lonely, but not alone. This is a horrible club.
Yes.
But it's also a very large one. And so when we talk about it, we help people also remember that this is Like nobody wants to feel the reality of the risk of miscarriage, or, it's less common to have an ectopic, but anyway, of pregnancy loss. And yet it's a risk we take every time we conceive. And so I think that talking about it is so important to help people understand that it happens. It happens frequently, and it's not anyone's fault. It's also important as lawmakers who have no health education make decisions that impact early pregnancy loss experiences. And so it's important for everyone to understand that this is not unusual and it's no one's fault. It's a thing that happens because nature, and it doesn't mean anyone did anything to cause it. Because in some states, I would have just died if my fetus, if my embryo, it wasn't even a fetus yet, still had a heartbeat. They wouldn't have let me take in the meds to terminate an intratubal ectopic pregnancy.
Yeah.
I think what I always hope is that gestational parents, particularly if they identify as women, because we are in our culture not encouraged to really embody the strength that we have as fully developed human beings. I always hope that stories like mine can help people connect with their own strength, that you deserve. It is your right to have bodily autonomy. It is your right to be in charge of your care. It is your right to make decisions about how you want to be treated by the people you have hired to shepherd you through this process of birthing your baby. And that you are always, I've never seen anyone who wasn't stronger than they thought they were, right? And so you can show up for yourself. And if you're not sure how to do that, that's what therapy is for. Right? Because a doula is great. I want you to learn how to be strong for yourself and not just like the doula helped me. Yes, the doula helps you, but ideally you're helping yourself. Right?
I love that. Arya, thank you for joining me.
It's my pleasure.
It's always so much fun to have conversations with you.
It has been very fun.
Thank you so much for tuning into my podcast. If you enjoyed what you heard, make sure you hit that subscribe button so you don't miss out on future episodes. Don't forget to share the podcast with a friend who can benefit from the valuable insights that we share here. And if you could take a moment to leave a 5-star rating and review, it would mean the world to me. If you're ready to work one-on-one with me to embark on a transformational journey towards a confident and empowered hospital birth experience, go to kellyhoff.com/empowered and enroll in my Empowered Hospital Birth Coaching Program. Together, we'll create a roadmap to a birth experience that you'll cherish forever. That's KELLYHOF.com/empowered. Let's make your birth experience extraordinary.